I think from a public attention standpoint, one of the things that has really come up that has solidified this movement of men's health is men's urologic health. And the reason for that, it really is based on a couple of entities. One is testosterone and testosterone therapy, which is getting a lot of media attention, and also sexual health. And the reason that both of those are important for men's health in general is those are good reasons for guys to come in to see their physicians. So from a sexual dysfunction standpoint, with the advent of medications in the late 1990s that successfully treated erectile dysfunction, that brought a whole new group of guys into the doctor that otherwise wouldn't go in. And what we know about that's so important is that men that have early onset erectile dysfunction, guys in their 40s, 50s, have a 2 to 3-fold increased risk of cardiovascular disease developing significant serious cardiovascular disease, heart attacks, in the next 10 years. And so that's really where the forefront of men's health is that indoctrination. In general, if you look at some of the barriers to discussion of some of the more sensitive subjects in health, it's sexual dysfunction, and men have a significant problem bringing that up with their doctors. They're embarrassed, they don't want to talk about it, they hide, and if you now say, here is a center where this is what we specialize in, so there is no subject you can't talk with us about, it really enfranchises men into the health community. Now at the Center for Men's Health at the Urology Center, again, we specialize solely in urologic health, but we certainly screen for all of the conditions that can really lead to a poor life expectancy in a male. So the minute he walks in the door and he fills out his intake sheet and he steps on the scale and we take a blood pressure, we've already done a pretty full health assessment about some of the things that can get him in trouble early on in life that are still reversible and preventable. So if I see a man at 35 years age who is not going to go see an internist because he just doesn't think his erectile dysfunction is enough of a problem to seek medical care for, or he doesn't think the internist is going to want to hear, or maybe he's been somewhere else where he doesn't get the same level of care, the same level of interest from his physician in his problems, he can come here and know that this is exactly what we do. It really is a top-to-bottom approach to especially urologic health, in that we have subspecialty trained experts in the field, national experts in men's health. We have a fully accredited freestanding surgical center, so if there's any surgical needs that happen that a male needs treatment for, they can be done on site. We have full capabilities to evaluate the urinary tract, so from a urodynamic suite, which is state-of-the-art, to a cystoscopy suite, where we're able to evaluate the prostate, the urinary system entirely, all with one-day appointments. That's, I think, the goal of this is that whatever care they need, we're able to provide here under one roof with really the nation's experts. There's no magic I'm going to do other than sit down and have a face-to-face conversation about what his investment in his health is. Now, what that becomes is a dialogue. So the dialogue is, what can I do for this guy to help him, because he's seeking help, 15 pounds overweight, still in his early 30s. So again, he gets a full blood screening panel, so I'm going to look at his cholesterol levels, I'm going to look at his blood glucose levels, looking for early diabetes. I'm going to look at his testosterone and figure out if there's any way that I can improve him from an endocrine standpoint to help him achieve those goals. But again, I'm going to put the burden on that guy, and my patients know this, that every time I see them, I want to know what they're doing that's different than the last time I saw them. Because if they're not invested in their health, then I can only do so much.